All right. So second question, every role in healthcare in healthcare at this point has some aspect of data analyst role in it. And how have you been able to build data literacy across an organization? And from outside looking in, it looks like a growing organization. So you're constantly not only educating the people that are there, but you have new people coming in.
You try to hit it from a lot of different angles. I've written a number of internal articles for our organization that gets published with our newsletters to start the conversation. We've also educated and then asked our C-suite and data governors to push back on folks giving them information, as I said before. But our most recent efforts revolve around an actual data literacy project. And within my team, we have a principal trainer who is focused on analytics, which is a bit unique in this space. And we're kind of leveraging her abilities around, so I'll call it supported self-service for the most part. But in addition to that, she's been tasked with coming up with a program for data literacy throughout the organization. What I found in my initial evaluations of this is that information products are being delivered to folks that is really over their heads. That when they look at it, the data is presented in such a way that unless folks have some specific training or skill set, they really are not probably fully understanding that. So we want to get ahead of that really quick. And so she's working on that right now. So we're on the front end of that. I hope next year, if we talk again about this, I can give you a little more feedback in terms of how far we move the dial.
Yeah, definitely. We'll definitely come back to that. So let's get pragmatic on this. What are the areas that you believe can utilize data to have the greatest impact on the communities that we serve?
Communities that we serve. Well, I think in our case, we're a medium-sized health system and we're not owned by a larger system. And we feel like because we know the community really well, we can provide great service. But in order to do that, we have to be financially solvent. And so surprisingly, I think I would start out with some financial data. I would talk about cost accounting, for example. I would talk about one of our projects right now is to focus on accounts receivable rejections. So it turns out that when you get rejections that come into your big bucket of rejections of payer claims, they have numbers on them that correspond to the payer, but they don't correspond to any kind of general interpretation. And so folks end up working those problems kind of one at a time, and it's incredibly slow. So what we want to do is really have a mapped evaluation of all the rejections that come in so that folks, when they come in, they immediately understand what the problem was, and they can work to A, rectify it for that individual claim, but B, put in place a process so it's not rejected in the future. And that's really the essence of data governance versus data cleaning. Data governance is really about not just fixing the problem, but putting in place the process so it doesn't happen again.